And our final speaker in this section of the afternoon is Dr. Nicola Meagher, and she's from the Ovarian Cancer Research Stream at the Daffodil Centre. She's going to be speaking about engaging with consumers in ovarian cancer research. Dr. Meagher.
Thanks very much to the organisers for the opportunity to speak today. I've decided to really kind of focus on the theme of today, engaging with consumers and community. And I'm calling this presentation The Why. So thinking about consumers in ovarian cancer research as really being the why we do what we do. Many of you will know about ovarian cancer, but just a bit of an overview. It's a devastating disease. Less than half of women survive beyond 5 years. Unlike many of the other cancers and much of the brilliant work that happens in the Daffodil Centre, unfortunately for ovarian cancer, we don't have an early detection test, we don't have a screening test, and there are limited prevention strategies available. For decades, it's been a one-size-fits-all approach to treatment. Thankfully, things are shifting. There have been developments in publicly funded genetic and tumour testing, and we now have a new treatment, PARP inhibitors, and this is starting to shift the outcomes for women with ovarian cancer. One of the things that I'm very driven to do is to ensure that there is equitable access to this testing and treatment for all patients. This is a little, that's given away a little line there, but that's okay. Focus of my research overview. So some of the things that I focus on in my research are examining publicly funded genetic testing and treatment practices for women with ovarian cancer, including those inequities in access, and trying to project patient outcomes and costs. Using large epidemiological data sets through international consortia, such as the Ovarian Cancer Cohort Consortium, to explore a role for aspirin within the clinical management of ovarian cancer. And then also examining differences in ovarian cancer risk and survival by racial and ethnic groups. So as you've seen, the ovarian cancer community, we're very lucky. We've got a small group, but they're a very feisty group of consumers who work with us along the way in addressing all of these questions. And I just want to come back to the why and talk to you about one of our wonderful consumers, Jacinta, another Jacinta. So Jacinta was diagnosed with ovarian cancer in late 2019. At that time, there was no publicly funded testing available, so she paid privately for her testing. And thankfully, she discovered that she was eligible to have access to PARP inhibitor treatment. So after her surgery and chemotherapy, she went on to complete 2 years of that maintenance therapy, and she's now approaching the 5-year mark this year. But during that time, as well as battling with her own disease, she's dedicated many, many hours to help researchers and to advocate for her community. So who our consumers are, they are a force to be reckoned with. They're embattled and they're fired up. Ovarian cancer is rare. It's not really talked about as much as some other cancers. The treatment is fairly brutal, and so it's created a really strong group of very passionate advocates who really support each other. There's a teal sisterhood. They meet for lunches. Sometimes their sisters aren't there at the lunch table because they're too sick. They lose them. It's a very, very powerful group of women. And I just wanted to highlight a podcast which is really worth listening to called On the Down Low, speaking up about ovarian cancer. So Jacinta's actually one of the voices on this wonderful podcast, and they won an award in 2022 for Best New Podcast. It's really worth a listen. So they're inspiring leaders and they are making meaning of their trauma. And now just sort of to reflect personally on the impact of the consumers on my research, there's Jacinta and another wonderful consumer, Jill Stannard, who's also involved in our community panel. That was at the New South Wales Cancer Conference last year. So working with consumers, I think, brings purpose and meaning. So beyond thinking about numbers in a data set, we're thinking about human beings. They offer us a lived experience to the questions that we ask in our research. they hold us to account. So I've had conversations with our researchers, and when I'm trying to articulate what I'm doing, I've been held to account to say, who is this for, to really help me try and formulate questions and think about what we're doing, and again, the why. They support us in our grant applications. They read our grants for us. They give us feedback. I had a conversation with Jacinta last week about a grant application, and as researchers, sometimes it's very hard for us to really fully articulate the importance of what we're doing, and I struggle with my language. And she just said, "Nikki, go for the jugular. This is important work, and you need to get that across." And that was really powerful advice. And then finally, and very importantly, they're our cheer squad as well. They help us in the highs and lows of the research journey. So that's all from me. I'd like to thank you. Big thank you to our consumers, all our colleagues at the Daffodil Centre, and funding supporters as well. Thank you.